Hi everyone, this is Larry Crisp with Prepare to Thrive and the Baby Boomer Backup Plan. The Ebola virus is a fast-moving story and it is no joke. As of October 10th, 2014, a BBC article reports global Ebola outbreak deaths exceed 4,000, according to the World Health Organization. The article goes on to say that there have been 8,399 confirmed or suspected cases in total. On Monday, the 13th, World Health Organization added Ebola was the most severe acute health emergency seen in modern times. October 12, 2014 marked the first case of someone infected inside the United States. 26-year-old Nina Pham is now fighting for her life. She was one of the Dallas nurses who cared for Thomas Eric Duncan, the first recorded Ebola death in the U.S. These deaths are not simply statistics. This is a human tragedy that rages on in a country that had said it was prepared. With the many mixed messages given by the media and the continued spread of the virus, it's hard to know who to believe. We were told Ebola only spreads from contact with the body fluids of an infected person. Yet, Miss Pham, the nurse in Dallas who treated Mr. Duncan, wore all the protective gear required to prevent infection. Prior to this, we wondered why he was turned away the first time he went to the hospital. Why a worker would power wash Mr. Duncan's vomit down a Dallas street drain and presumably right back into the water supply. The logic of not telling a health worker who assisted Mr. Duncan in the ambulance heading to the hospital the second time until 48 hours after the fact. To keep everyone calm and subsequent to Mr. Duncan being admitted to the hospital, a Dallas judge, Judge Jenkins, visited the Duncan family without wearing any protective gear. He's quoted in the Washington Post article of October 6th saying, "There was no risk." "I'm a married man with a little girl," Jenkins told reporters later that night. "I was in their house next to those materials, meeting with them, listening to them, and assuring them last night, and again, of course, today. If there were any risk, I would not expose myself or my family to that risk." He added, "There is zero risk." Listen to him now explain, "I'm wearing the same shirt I was when I was in the car with that family." And now, listen to the difference in his tone and demeanor when he announces a week later that it has spread.
We've got to get better at it. As a nation, we've all got to work together. State to state as well, because some of these materials have to cross state lines for a variety of reasons. So we've all just got to work together. We've got to trust the science. We've got to get a lot faster in our bureaucracy for the next time that this happens. And it will likely happen again because a disease knows no borders.
If the judge says zero risk, but Mr. Duncan's bodily fluids are now in the Dallas sewer system, while at least one health worker was not told about their exposure in a timely fashion, and a nurse attending Mr. Duncan took the highest level precaution by wearing full protective gear, has now been diagnosed with Ebola, what gives? These incidents reveal but a few of the mixed messages we as Americans are receiving from the government and the media. Such discrepancies lead to more questions than answers. But one thing is for sure, more and more people are wary of the potential insecurity of public crowds, air travel, and even corporate workplaces. What are the questions you need to be asking, and what can anyone do in this fear-filled environment to sustain basic personal and financial well-being? Are we now on the brink of Ebola economics? Even if you have no particular concern of being exposed to Ebola, you may well feel the impact of Ebola on your pocketbook. What will you do to prepare? What is the truth about the spread of Ebola in the U.S., and how will you be affected? So far, Americans have been getting lots of mixed messages. Ebola has become a political football, and the blame game goes on, leaving more questions than answers. Thomas Eric Duncan's family blames the hospital that sent him home. The CDC blames the hospital in Dallas where a nurse has become infected. A progressive political ad shown in Kentucky blames the GOP for budget cuts, implying their impact on the Ebola issue. But blame is not going to help us. We need answers to questions like, why aren't flights from Western Africa being halted by the U.S. like British Airways and Air France, Kenya, and Korean Airlines have? Why don't we find more coverage in the media about the studies exposing how Ebola turned airborne among animals? The CDC classifies Ebola as a level 4, which requires the highest level of protection. Are all U.S. hospitals prepared with hazmat suits, training, and proper isolation facilities? If a single Ebola patient can overwhelm and shut down an entire hospital emergency room indefinitely, what is going to happen as patients 1, 2, or 3 show up at their local hospitals? With a grand total right now of only about 19 biocontainment rooms in the U.S., how many cases would it take before the system is totally overwhelmed? Is this just another scare like the swine flu was back in 2009 while the pharmaceutical industry was ready with a vaccine that they then cashed in on? What will prevent President Obama's July 2014 amendment to Executive Order 13295, which redefines who can be quarantined from being invoked improperly to involuntarily quarantine at a whim? It gives any police officer or health official, without question and on suspicion alone, the power to quarantine if they decide someone in a household shows any sign of respiratory illness. Which brings me to the all-important question, que bono? When all is said and done, who will have benefited from Ebola coming to the U.S.? While we need answers to these questions, we also need to be proactive with personal solutions where no official one exists. Beyond avoiding contact with the bodily fluids of those infected, for example, preppers are buying up respiratory masks and have high-dosage vitamin C on hand. Others are limiting their air travel. This is also a good time to consider another simple and long-term solution. Develop work you can do from home. In today's vulnerable social and economic environment, work needs to be portable, international, and lucrative to allow you to interface with the world at large on your own terms. Having a home business that actually supports you and then some is not just a pipe dream, but it does take effort. When you find the right business, the right fit for you, it can expand you and your family's sense of autonomy, safety, and wealth. Among the most obvious of home-based solutions for generating income is working online. Low overhead, low startup costs, work from anywhere with a laptop and a Wi-Fi connection. Not all online models are the same. Generating traffic can be expensive, labor-intensive, and take a long time, so you do need to exercise some caution. The impact of the Ebola economy may be felt sooner than you think. It might be time to investigate a viable backup plan.